White Americans. According to the U.S. Census, the term white refers to a person having origins in any of the original peoples of Europe, the Middle East, or North Africa. It includes people who indicate their race or races as white, or reported entries such as Irish, German, Italian, Lebanese, Arab, Moroccan, or Caucasian. In the 2020 census, 74.8% of the U.S. population identified as white alone. However, this includes individuals who also identify as Hispanic or Latino. When we separate ethnicity from race, the percentage of non-Hispanic whites is approximately 57.5%. This distinction is critical for understanding health disparities and population trends. The median age of the U.S. population is 39.1 years, and whites have the highest median age of any group. So in 2020, the median age for whites was 44 to 45 years, Asians 36 to 48 years, Black African Americans 34 to 36 years, and Hispanics Latino 30 to 31 years. The white population immigrated to the U.S. from diverse countries. Thus, there are diverse ethnocultural and religious heritage, as well as health and healing traditions. The most common ancestry are German, Irish, English, Italian, Polish, Scottish, and French. Whites in the U.S. are not composed of just those of Northern European descent. Several are not well known to the U.S. health professionals, and they include the Amish, Romani, and Arab and Middle Easterners. Due to their geographic location and sociocultural factors, many health professionals may not interact with the Amish and Romani in the healthcare system. However, it is still important to understand their cultural beliefs and values, especially as it impacts health. These populations are addressed in other course materials. Health issues. Recent national data showed that 9 to 10% of Americans of all ages are in fear or poor health. Whites have the lowest rates of people that are uninsured. Whites approximately 6%, Asians 6.2 to 6.5%, Native Hawaiian and Pacific Islander 7 to 9%, Black African American 9.5 to 10%, and American Indian Alaska Native 13 to 15%. Infant mortality rate. The infant mortality rate is calculated by the number of live births per 1,000 live births. So we can look at the infant mortality rate and see that Asians have the lowest at 3.5 births per 1,000, white at 4.5, Hispanic Latino at 4.9, American Indian, Alaska Native at 8.0, Native Hawaiian, Pacific Islander at 9.0, and Black African American at 10.8. The top 10 causes of death in the U.S. are heart disease, cancer, accidents, stroke, chronic lower respiratory diseases, Alzheimer's diseases, diabetes, kidney diseases, chronic liver diseases and cirrhosis, and suicide. In summary, white populations in the U.S. are diverse and cannot be understood as a single cultural group. While mainstream public health data provide useful general patterns, they do not capture the full range of experiences within this population. Understanding dominant cultural values, healthcare structures, and variations in access and behavior supports more effective health promotion strategies.